Good morning, Karen.
Good morning. How are you?
I'm very well, thank you. And thank you
Good.
so much for taking time to speak to me about this subject. And just really want to put it in context a little bit before we get started. We are not suggesting that any reflexologist should be getting involved with injectables. Just want to put that on the table. But just to sort of put it into some kind of perspective, Karen and I have known each other for many years, many years. We
Let's just say
we
many
trained
years.
together. We then talked together. I think you're a little bit younger than me, actually.
About a year.
Not much, but a little bit. Um, and we both started off with our careers doing the thing, doing the job, and then we went in completely different directions. So I went into the educational side of the industry and qualifications, and Karen went into the high-end treatments, shall we say, and was there right at the very beginning when the aesthetic revolution kind of was born, which was back
Yeah,
in
absolutely. Yeah, definitely.
2000-ish.
Yeah, just pre 2000, but
Mm.
yes, that was kind of when it was emerging, and yeah, and then there were a lot of people having the treatments, but not many people talking about the treatments, and certainly not many practitioners doing the treatments.
Yes. So just to be clear then, you didn't go straight out from industry and start injecting people and doing things. You were supporting the medics that were doing this and bridging the gap between, if I got this right, making sure that their skin was in optimum condition to be able to accept the treatments. Why is that important?
Um, so just sort of stepping back on that point, I got involved with an aesthetic doctor, and they were coming. These medical doctors were coming straight from NHS practice, so they didn't have the kind of the consultation skills, the aesthetic skills, all of those things that were required to then work in private practice. And even though these treatments were medical based, they were still discretionary. They were still for aesthetic purposes. So let's call it beautification, if you will. So the patients were coming not because they were sick. So there had to be a different communication, a different style of communication with those patients, and a different setting that was not like an NHS practice. So that's kind of where I was bridging the gap in those terms, because the medical practitioners didn't have those skills, whereas from a beauty therapy background, we did have those skills.
Mm, mm,
Um, they also then, going forward on that, didn't have the knowledge of the skin.
mm.
Um, I wonder if we did as beauty therapists 30 years ago. We know so much more now, but we certainly knew more than these many of the aesthetic practitioners, medical practitioners coming into it at that time. So absolutely, Louise, that's kind of where we were in kind of manipulating it into the kind of the medi spa that we know now, and looking at the skin and optimizing the skin health. Before and during and after having these medical aesthetic treatments.
Fabulous. And you're absolutely right. Beauty therapists and complementary therapists have so many soft skills that can bridge the gap and be very helpful.
Yeah.
So what we really wanted to ask you today was that the reflexology world has expanded, and a lot of reflexologists now work on the face as an
Yeah.
area. And whilst not all reflexology facial protocols include understanding about the skin,
Mhm.
it's understood that actually clients are going to have some skincare concerns.
Mhm.
And how can reflexologists expand their knowledge a little bit more to give more advice and guidance to their clients? And it also offers the opportunity for a little bit more understanding of products as well, and products ingredients, and what advice can be given, because we know that a lot of clients will be persuaded to try and use products from samples that they find in magazines. I don't know whether that still happens, but you know, the sample hunters that go into the shops and just pick up all sorts of things. But also somebody, one of their friends maybe, that says, oh, I've used this product and it's amazing for me, doesn't mean to say that it's amazing for them either. So when I teach skincare, I have this other skin type or skin condition called a confused skin. And this is a skin where it's had so much stuff chucked on it. So you might see irritations on the skin. Might not be anything to do with the products on their own, but it's a combination of all sorts of other things that people are putting on their skin. So we do think it's really, really important that therapists, if they are working on the skin on their face, that they understand the skin, but also understanding what treatments are out there that our clients might very well have had either recently that might be a contraindication or a restriction. What we can, as therapists, what can we do about them? So what I'd like you to do is to go through all of the things that you get involved with that it's likely, or you think it might be likely, that those clients might end up on the reflexologist's table for some facial treatments, and a little bit about how they work, just so that our therapists have some understanding.
Okay, so going back, because there was a lot to unpick there, Louise, in that long sentence. So if I might start with how they might, because this can be very confusing, and we're not suggesting for 1 minute that everybody becomes an expert in everything. They are an expert in what they're doing, but as you're quite right, they need to have knowledge of it. And I think there's two aspects to this. One is working collaboratively, so that they are, I mean, I work in a multidisciplinary team with plastic surgeons, lifestyle medicine practitioners, that kind of thing. So that's a really good environment for me to have lots of discussion, reflective practice, all of that kind of thing. But I also have a clinic on my own, which is supported by them. So I'm very lucky. But some of the practitioners that you might be speaking with are working on their own. And I think having a collaborative approach with other reflexology practitioners, but also, therapists, aesthetic practitioners who they trusted partners, who that they can seek advice and also point their patients or their clients in that direction if they want to have advice that is trusted. And because there are a lot of people out there who offer these kinds of treatments, who and we're talking medics, non-medics, everybody that might not be giving the advice that is for the benefit of the client. It might just be more for the benefit of their bottom line. So it's really important to get a network, I think, and that best serves their clients as well. And then the other aspect of it is in their consultation process. My consultation now has completely changed and developed over the years, and I won't start doing any treatment until I've got an overview of the patient's well-being, nutrition, hormonal health, skin health, happiness levels, stress levels, gut health, all of that kind of thing. And it's very simple. I don't have to be an expert in it. I can just ask the questions and I get a much bigger picture. And I think then the reflexologists, if they're formatting their consultations in that way, which I'm sure they are, they then start to see this bigger picture. So when you were talking, for example, about their skin health, if there's inflammatory problems, once they start looking at their diet, their stress levels, those kinds of things, they can then start to see a much bigger picture and not just the skin. They're seeing different sides to it. And I think these complementary therapies, it's a two-way process. So for example, for me, when I have a patient in front of me, who's got skin, and they've come for their skin concerns, but they're really stressed, their gut health is poor, I wouldn't start with topical treatments. I would go back to those stress levels and maybe have complementary therapies where they're going to start to relax and look after their well-being. So it really is a multidisciplinary approach, and it's the sum of the parts. The outcome is the sum of the parts. So it might not be in some cases it might just be a single treatment, but sometimes you have to look at the bigger picture.
I think what you said about collaborative working is probably the most important thing, because reflexology is just one part, and we ask a lot of questions on the consultation forms that I have always been quite critical of, because it's, so what? You're asking these questions, but so what are you going to do with the information? And I get very worried when I see consultation forms that are very, very in depth, unless the practitioner is going to be able to take that information and do something with it.
Yeah,
And quite often, the practitioner, as a reflexologist, does not have those skills.
no.
And I see a lot of reflexologists who are really struggling themselves, and they really ought to do their own consultation on themselves to
Mm,
actually think about, well, I've got this problem, this problem, this problem, this problem. What am I going to do about it? Because
mm,
that's how you grow and educate yourself to be able
yes,
to then network with other people and say, well, actually, this looks like an inflammatory condition. Why don't you go and speak to Amanda about your gut health? That
exactly.
might be a trigger to actually, yeah, I've been thinking about that. I wasn't really sure whether, I
Yeah.
was, and that's what it's about, as being a professional, I believe.
Absolutely. So, as we say, they don't need to know everything, but there'll be red flags. So,
Yes.
hormonal health, and you say, okay, well, look, there really is no point. We can start doing a few simple things with your skin,
Mm.
but let's have a look at the hormonal health first, and and get all our ducks in a row. And I think that's important. So, it's having a general knowledge, but having the people that they can trust to then refer to and
Mm.
to support them with that process. Now, their clients might not take that on board, they might not do anything about it, but you've been the professional and you've pointed them in the right direction. But also, from a point of view of you're saying, are we asking too many questions? Are they too in depth? I then write that up in a summary in an email, and it could be 3 or 4 pages long. What it shows is that you care as a practitioner. You're not just doing a 10-minute consultation and then doing the treatment. You're looking at as a big picture. You're supporting them for the short term, medium, and long term, care pathway. And they know that you've listened to them. And that makes a very, very big difference. And you've started to build that trust and you've started to build that relationship. And that is key, I think, to any of these treatment plans, and then the outcomes, and that kind of thing. And then, they get it in a summary. And it then also serves you as a baseline to look back on. So when you do your reviews, you can look back at some of the, for example, I remember doing somebody with hormonal health, and they took my advice and they went off to practitioner, but the practitioner hadn't really scored anything. And I said, well, let's do the score, shall we? Let's score out of 10 your hot flushes, out of this. We went symptomatically. And then sort of 6 months later, when she'd been on HRT and we'd been doing some other bits and pieces, we rescored, and she was amazed at how improved she
Mm.
was.
Mm.
Now, I wasn't the person doing her hormonal health, but I was
Yeah.
part of that care pathway.
Yeah. And I think that that's the way in which reflexologists need to start to think about their business, because what you said about doing a follow up, I'm not sure that there are many reflexologists that actually communicate to the client after their first treatment. So to
Right.
actually send them an email to say, these were the things that was an outcome. These are the things that I think would really benefit you. I think is really powerful, and it also then comes into your retention marketing of how you're actually going to grow your business because you do something that other people don't do.
Mm.
Um,
Totally. And when they come back for treatment, I mean, I see it all the time in clinic with practitioners who the client or the patient walks in, and the, and I've heard it also from patients that have come to me. They've gone to the practitioners, and the practitioners have almost forgotten who they were. Whereas what I try really hard to do is I reread, either if they're coming back the second time, I reread the consultation that
mm,
we had written, and I put some highlights through so I can pull that out quickly when we're talking. But I also write quite detailed notes at every treatment, so that before we even start a treatment, we will sit down and we will look back on the last treatment and we will discuss that. And I think that just makes them feel, again, heard, individual, it is bespoke,
mm.
and that speaks volumes, and it speaks volumes for retention and the kind of practitioner that you also want to be.
Absolutely. I'm going to pick on something you said just a moment about red flags,
Yes.
because this is something that in the qualification that we deliver for reflexology, there is an assignment that they do, which is about identifying in your treatment what would be red flags for you. And one of the things that is not really talked about in the complementary therapy world, but it is within your world,
Mm.
is, and I've got to get this right, it's body dysmorphia.
Disorder, BDD. We'll call
I've
it
got it written
BDD
down, but I
because
couldn't
it's so
remember
much
what that meant.
more important.
Mm. And I just wondered whether, as a reflexologist, if we get back on topic to these treatments, a client that is changing their face shape, that is, so going back to not having facial reflexology for a moment, but as a practitioner, if we see that there is this change going on in
Mm.
body or facial, or we ask a question and they are a little bit evasive about what they've had done, is that something that could be or should be a red flag for us? And if so, what do we do? So could you just explain a little bit about BDD and your take on it from our perspective?
Yeah. Okay. So I do a part of what I do as well that supports my work, because I felt this was really important, was the first aid for mental health programs.
Mm,
And the reason I got into that was because I had in my career, I had a bit of a breakdown, which was related to work-based stress. And I kind of had to have a complete reset. And I just looked at it afterwards and thought, nobody's looking after the welfare of staff
mm,
and the workforce and everything else. And that's just so important. And the well-being of them. We talk about we're in a wellness
mm,
industry, but I don't see many clinics, larger clinics or salons or whatever, really supporting the wellness and the well-being of their staff. They might say they're doing it for their patients, but they're maybe not doing it for their staff. So that I kind of wanted to then make that kind of specific to our industry. I'm going off on a bit of a tangent here, so I have to keep coming back to it. And I did a talk at an aesthetic medicine live conference on vulnerable patients, and I kind of started we had some amazing speakers. So that kind of brings me back to, I'm not an expert on BDD, but we did have some experts there who are amazing, who've done some brilliant studies. And mine was coming from a practitioner, as you say, looking at red flags and how do we deal with that. And my starting point was, I feel that anybody coming for aesthetic treatment is a vulnerable patient. They're vulnerable. They're at their will of whoever's sitting opposite them, what they're going to do to them. So that's important. And that's where we have to look at this bigger picture. Part of my consultation is to ask them about previous treatments, what the outcomes of those treatments were, why they wanted those treatments. And we really explore that. And I also ask them things like their stress levels, but I ask them about their happiness level, which might sound a bit odd,
mm.
but
Yep.
it's important to find out if people are generally happy,
Mm,
because these treatments that we're doing, for example, they might give them some more confidence, which is really good, like having your hair done, those kinds of things. They're not going to change your personality type. If you're an unhappy person, you're not going to suddenly become, not going to make you happy. So we really have to drill down to that person and look at what they're expecting from these treatments. And I write it down, what their
mm,
expectations are, why now, all of those things. And I think over that period, I mean, my consultations take around 60 minutes, and I've got the luxury of doing that. I really appreciate that. And they can take longer if need be, but I get a much better build a much better picture of that person because of the questions I'm asking. And I appreciate if you're in a commercial environment, or even if you're working for yourself and you're very busy, so you are trying to structure your, get as many people in for treatment because that's what they want to have. You haven't got that luxury of having those kinds of long-winded kind of consultations. You could do something maybe as a questionnaire that you send out before, but that doesn't really help because people do manipulate it a little bit. But in my kind of consultations, I can start to see a picture. And So if I suspect there is some kind of BDD, then depending on the severity, um, obviously you've then got to bring that to the attention of the person that is in front of you. And it's a bit like, Louise, when we trained years and years ago, I don't know if you ever remember when we trained in our hairdressing, we had a whole lesson on how to tell somebody that they had nits.
I do.
You remember? So it's a bit like that. How do you bring this subject up? How do you start the conversation? What language do you use? And it's not easy. And I honestly believe I've got better at it as I've got older.
Of course, yeah.
I think younger, and that's not being, in any way derogatory, but younger practitioners might find it harder. I also think because I'm in control of my own workload, I can do it. So, for example, I had a patient that I'd actually spent 2 hours in a consultation with. She had very unrealistic expectations. We seemed to unravel it and put it all into some kind of order by the end of it. I put it all in an email, and then I had this strange text coming back to me saying, oh, I felt a bit disappointed when I left. I thought we could do this, this, and this. And I thought, gosh, she hasn't actually heard what I've been saying. So I wrote a very nice text back. And the summary of it was, I don't think I can meet your expectations. I don't think I'm going to make you happy. So I'm really sorry. And if I could maybe point you in the direction of somebody else, then I'll be more than happy to try and do that for you. But I had the courage to do that because financially, I mean, it would have been nice to have some, have that treatment and to take the money, but I don't think I'd have ultimately made her happy, and it would have come back on me. So, I think it's a big subject that probably you and I could work on to help, because it's not just something you can summarize in a couple of sentences, but I think it is looking at your business and having that courage to identify these types of patient types, and then work out how you are going to manage that, bring the subject up, and maybe then if you've got this multidisciplinary team, get them some help.
Yeah, I think it's actually very relevant, and I can imagine that some of the reflexologists listening to this will be thinking, well, that doesn't apply to me, but actually I think it really does.
It does. It
Because
does. If you're a practitioner, I see myself now, I'm a practitioner, I might do certain, let's say, micro needling or whatever, but I think I'm more than that to my patients, and I want to be more than that. And I'm not saying, as I say, I'm an expert in this, that, or the other, but I can give some care, and if somebody is in need, signpost them to where they might be able to get help. Now, going back to BDD, I mean, if you've got somebody sitting in front of you who clearly has an issue, and you refuse to do treatment, not but just to say, because I don't think you need this, I don't think it's going to achieve what you want to, it's almost certain they will go somewhere else to find that treatment. But you've had the integrity to not do it. You've had the courage to say, I don't think you need this, and I think if you progress along this pathway, then you might have some problems further down the line. And it's funny because I've had patients come back to me years later, having had treatments with other people, and said, gosh, why did they do this to me? They don't take ownership themselves, but I'm glad I wasn't part of that.
So I'm thinking from the reflexology point of view, there is, we had an amazing result from a treatment. This is one of our students who was doing a case study and performed a treatment on a client who has got a something, I can't remember exactly what it was, but it was a brain something or other, small vessels to blood wasn't getting to his brain, and it was not diagnosed as anything that needed any treatment or special care or anything, but what happened was he had tremors. His hands were tremors, so it was like a little bit to Parkinson's, but it wasn't. And after one treatment, the tremors stopped.
Wow.
That's pretty impressive.
Absolutely.
So what we've now got, And I was saying to the client, you have to be really, really careful, because that client now believes that reflexology did that.
Mhm.
So reflexology might have done that, but that's
Mhm.
not for us to say. It's not a medical treatment. And
Mm.
what clients will then do is come to practitioners to say, I would like reflexology to stop this, make this. I'm trying to fall pregnant and I've heard
Mm.
reflexology helps. Well,
Mm.
it does, but if their expectation is that they're going to have reflexology and then they're going to fall pregnant,
Yeah.
or they are going to have reflexology and then they're going to not have to have bowel surgery, or what it is, if their expectations are too high and they have the wrong idea of what they're coming for, that is equivalent to you not doing a treatment because what your treatment won't make them happy
Yes.
aesthetically.
Depending on how you manage it. So you're
Mm,
absolutely right. Find out their
yeah.
expectations, that match their expectations, and on the under expectations on my consultation form, I have does it match? And I
Mm,
will say to somebody, look, this treatment isn't for XYZ. It's for this. But you know what? If there's a side effect where you get
yes.
a positive outcome in a different direction, absolutely, that's brilliant.
Yeah.
But the important thing is I have documented that in that original
Mm,
email and said, this isn't for this, this is for this. I appreciate you've come for
mm,
other reasons. And part of, if you're doing, other things, maybe it can, as a collective, it can be helpful,
yeah.
but certainly this isn't a treatment for that outcome. So I think the documentation of it, the saying it out loud to the patient, but often
Mm,
they don't listen. And, with somebody like that, let's say, who's trying to fall pregnant, they can be very desperate. And you're again dealing with a vulnerable patient.
yes.
And that's to have the integrity, but to have the care and the support is
Mm,
really, really important.
mm. We ought to talk about some treatments.
Yes. What do you want to talk about? Which one?
Let's start with Botox. Now, I
Yes.
know Botox is a brand name, is it? Or is it
Yeah, yes, it is. Yeah. So neurotoxins, they are,
neurotoxins?
yeah,
Lovely. I mean, you
yeah,
just got the word toxin and yeah.
yeah, yeah. Botulinum toxin type A, it's a neurotoxin, and what it does, it disrupts the messaging from the motor nerves getting through to the muscle that it's placed in. Um, It's a well-established drug. It's been used in medicine for many, many years. And around 25 years ago, they were using it there was a husband and wife team called the Carruthers who were using it in a medical setting. And they suddenly noticed that these patients who they were using on, I think were mainly stroke patients, started to look a lot younger. And they thought their little light bulb went off in their head, and they thought, oh, we think we could make some money out of this. And they're very, very, very wealthy people now. So that was kind of how the aesthetic side of it was born. Um, and as I say, it's used in all sorts of medical settings, from using prostates, speech problems, all sorts of things, migraines, that kind of thing. So it's
Sweating as well, I think, isn't it?
kind.
Used for sweating. People that have,
Yes, hyperhidrosis. Yeah,
yeah.
absolutely. So it's a well-researched drug, and in safe hands, it can work amazingly well. It can be life-changing for some people. So in an aesthetic practice, we use it in the facial muscles, and also muscles of the neck, and as you say, for hyperhidrosis and various other things. They're coming up with all sorts of things
I can
for it.
imagine.
It's quite good for from a rosacea point of view. You can use toxin very superficially in the skin as like a micro kind of placement of the toxin. You can use it on scars. It's very well researched in the use of scars. So it has a lot of good uses, and in good hands, it can work very, very well and naturally. As with all of these things, they've all got a place, and it's about the placement, the practitioner, and the product that's used, basically, and the knowledge that that practitioner has. So if we can disrupt that pathway, that messaging pathway between the sensory nerve ending and the muscle, we can temporarily stop that muscle from moving. And from an aesthetic point of view, one of the main reasons that we develop static lines in the face is because of that muscle movement, that constant contracting, relaxation. The skin above that, what we call the SMAS layer, becomes stressed and basically degrades. The extracellular matrix becomes weakened, and we start to see static lines in the face. So Botox is a line preventer. It's not a line filler. It's not a treatment for the skin, aside from things like we're using it in rosacea and whatever. But primarily for what we know it, the use of, it's a muscle relaxer. And for a period of time, that be anywhere between 3 and 6 months, the muscles temporarily cannot work. We haven't damaged the sensory nerve, we haven't damaged the muscle. So there's no damage. However, I do say to patients, if they're heavily Botoxed and they repeat it very, very regularly, maybe too regularly, there can then be some muscle wastage of the muscle because it's obviously not being used. So there's lots of things to explore, and there's lots of different patterns that you can use, and different things. So that's how that works. The actual medication goes into the muscle and that you're targeting. Hopefully, if it doesn't, then you might have other muscles that are affected, which are not good. And we kind of look at, the absolutely fabulous sketch where, I think I won't even act it, but she comes in and pretends she's had Botox, which is completely not. Well, it would happen if you hit all of the muscles that were, lifting the mouth corners. But I've lost my train of thought here now. So yes,
Into the muscle.
that's for a short period of time. So it's a targeted approach into the muscle. The neurotoxin does its job, and then it is pretty much dissipated out of the body within a few days. The toxin is not there anymore. It is the result of what that toxin has done to that synapse, that gap between the sensory nerve and the muscle, and that's where you get the longevity from. So from a point of view of doing treatments, doing anything before Botox, not a problem. You can do any of those treatments. But post Botox, I would definitely say from a theoretical point of view, we would always tell patients not to touch the face, not to massage the face, because we don't want that Botox to migrate down onto other muscle groups that we don't want it in. So they have to keep their head up. They have to work the muscle groups. So we would say that for, about 24 hours. Thereafter, they can go back to their normal routines. However, from having other treatments, we would always say, because you know what clients are like anyway, if you say don't do something for a week, they'll do it after 2 days. So we always just increase that. So I would always say, do not do any facial work for 2 weeks post the patient's review, because with Botox, what you generally do is you do a treatment, and then most good practitioners will have that patient back 2 weeks later to review the treatment. At that point, they may have to put some more toxin in to adjust certain things, and then that would take another 2 weeks to work. So I would say at least 2 to 3 weeks after the last treatment, whether that be a main treatment or the review, and then you can start to do treatment, because you are not going to do any harm after that period of time.
Okay, that's good to know.
And I think when we spoke about this some time ago, the only treatments are beauty treatments that we would not want them to have are things like muscle stimulating treatments like Casey and that kind of thing, because we don't want to encourage that muscle movement back quickly, because that would affect the longevity of the treatment.
So with the facial reflexology, now I can't speak for everybody's facial reflexology, but the Miandui facial ritual that we have created actually includes muscle lifting. So we are actually stimulating the muscle fibers with small movements. So from that point of view, other facial reflexology, I believe, is pressure and slight manipulation,
Right.
no real lifting. So would you say that pressure is fine, which is the same as massage, but muscle lifting is a little bit more because we're wanting to refine the muscle?
Yeah, I mean, I'm assuming with the lifting, you're trying to improve the tone of the
Yes.
muscle through
Yeah.
blood circulation.
Yeah.
So I don't think by doing that therapy, you are going to have any impact on the sensory nerve, or that gap
Yeah.
between the sensory nerve and the muscle. So I don't think it will be I don't think it'll be to the detriment of the treatment.
Okay.
I think by improving the circulation to the muscle, there's no harm in that.
Mm.
So actually, theoretically, I cannot see any problem with doing that.
Fabulous.
It's only when you are trying to stimulate the contraction of that
It's the
muscle.
contraction. Yeah. So does that then extend to facial yoga, where you
We
are
can.
actually trying to
Now, I'm going to be controversial, aren't I? Because I think in aesthetics, we would,
poo-poo
we,
that one?
well, we don't poo-poo it, but we say, don't don't do that. So there's probably pros and cons, but we are not a great advocate of facial yoga. But equally, for those people then who are not going, kind of, if you're going the aesthetics route, then don't do that, because that's almost like contraindicating. But if you're not having those kinds of treatments,
Yes.
then absolutely, it's a great thing to do.
Yeah. Okay. Fantastic. Fillers.
Fillers. Oh God. Okay. So
Oh, just going
fillers.
back, sorry, just going back
Yeah.
to Botox for a moment. One of the things that I do hear people say is, I wouldn't want any toxins in my system.
Mm.
You then said that it goes into the muscle. Now, obviously, muscle has a blood supply, and blood supply
Well,
will remove
yes,
that
yes.
toxin, but it's not in your body as such. It's not a toxin in your whole system, is it?
No, 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 no. As I say, it's dissipated very quickly. And if you've got we're working on healthy
Yeah.
people. We're working on people who've got, kidney, liver disease, that kind of thing.
Mm.
So we're not overloading their system. We're using very, very low doses. We're using such low doses compared to what they would have in a medical setting. And let's say, for example, if they went to a neurosurgeon to have their Botox for migraines, they're going to have big doses, really big doses. So we're talking about very, very low doses. They use Botox on children as young as 2. Now, if you do that, you've got to have the research behind you. So, we are not talking about overloading your system. Now, this is all about choice, Louise. We
Mm.
make a choice. We make a choice in the end of the evening to have a glass of wine.
Mm.
We go out and we're breathing in. Unfortunately, we've got no control over that. We can wash our clothes in horrendous washing powder and things like that that's touching our skin. We put perfume on ourselves. We're introducing ourselves to a toxin overload a lot of the
All the
time,
time.
aren't we? So this is about choice, and it's not
Mm.
everybody's choice to have it. And that's what I say to my people who come to me. This is discretionary. You don't have to have this, but I'd rather you have all of the information presented to you, so then you can make your own choice. And it's very similar to HRT, no different in
Really?
that sense,
Yeah.
in terms of, do I want to put something in? And there's never a magic wand, there's never a quick fix. There's always a consequence, and you have to look at those consequences, and you have to decide for yourself. But you have to have as much information as you can
Mm.
to make that informed decision. And so, yes, going back to your original question, I mean, I'm not here to convince people, oh, the toxin's gone very quickly, blah, 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 all this kind of thing. But yes, in terms of what it actually does, it's out of your system very quickly. And on a healthy person, and then the doses that we're using, it should be no detriment to the body.
That's really good to know, because I believe that an awful lot of complementary therapists will have this big, scary idea that having Botox is really, really a bad thing. And actually,
Yes.
what you're saying is that it's no worse than some of the things we do on a day-to-day basis, especially with
Absolutely.
putting alcohol into our onto our.
Absolutely. But as I say, it's a choice. So,
Yeah.
we are in control of something. So, for example, we can choose not to have Botox, we can choose not to have the glass of wine. Unfortunately, we can't choose the air that we breathe.
No.
So we can control our environments as much as we want, we
Mm.
can and are able to, and we can decide to live our lives how we want to as well. And you know, there are some people who have these treatments who it really does make a difference to them,
Mm,
a
mm,
positive difference. And that's surely, and again, this is not about convincing people,
mm.
but this is about well-being.
Yeah,
And wherever you get that well-being from, that's important, because that will give you healthy longevity, and that's what we're all aiming for.
yeah. Fillers.
Fillers, well, well, okay. So fillers are, I mean, we could sit here for hours. So I you know,
In a
there's
nutshell.
there's lots, yeah, yeah, it's very difficult to be in a nutshell, but let's just take the main filler that the majority of practitioners use and the majority of patients would have, that you would see, your reflexologist would see in their clinic, and that's hyaluronic acid filler.
Yeah.
Now, hyaluronic acid, you know, is natural to our body. It's a humectant. It's good for joints, all of those kinds of things. And in that form, it has been used um, in the medical setting for a long time for joint therapy, as has PRP. So a lot of these treatments that we use in aesthetics have already been used in a clinical medical setting anyway, and have had that kind of review, peer review, study, all of those kinds of things. And then some clever soul has thought, okay, well, how can we make money out of this in aesthetics? So that's kind of normally the route to market, really, with these aesthetic treatments. So
Can I just stop you there? You said they've been used in medical and you said joints.
yes.
So people that have got arthritis or
I will have to send you some research on that, and then
okay.
you can look at that. But because it's not springing to mind exactly, so I'd send you information on it. But years ago, all we had at our disposal was mainly collagen fillers, and they were animal derived,
Yes.
bovine or porcine. So there was a lot of problems with allergic reaction, and they didn't last very long. You had to do a patch test before you did the treatment, and there was all sorts of issues with that. Then the hyaluronic acid became much more popular because it wasn't of animal origin completely. And also, the other thing was we had an antidote to it. We could reverse it with something called hyalase, which again, that's a huge subject. But it's not a magic wand, but it's a safety stop point for that. So this let's go back 25 years ago when these treatments become popular. There was very little understanding about the product. There was very limited understanding about aging. So they were being used with that criteria, limited understanding. As time has progressed, in that time, we've learned a lot more. We've learned a lot more about aging. We've learned a lot more about the product and the rheology of the product and the placement of the product and all of those kinds of things. So we do have a throwback to people who were overusing it years ago, which you can see evidently. But we've now moved into a phase where we're much more into regenerative medicine, much more natural medicine, harnessing, biohacking, for example, that kind of thing. We still have a culture in certain groups that kind of like to look like they've had some treatment because it gives them, I don't know, status or whatever. And also, from a value for money, if they've paid for 1 mil of filler, they want to see 1 mil of difference, as it were. Do you know what I mean? So if somebody doesn't see a difference, they don't think they've got their money's worth. So there's still that kind of mentality to kind of battle with. But fillers used well for certain indications, fillers can work well. But unfortunately, they have been overused. Unfortunately, when patients go to practitioners who only do fillers, So that's their only tool in their toolbox. And they don't have this multidisciplinary team, and they don't want to send them somewhere else because they want to get the financial gain from that person. They will do those treatments, and it might not be the right treatment for them. So there's all sorts of complexities with the use of fillers. So from a point of view of your reflexologists, fillers, once they're placed in the skin, they can be placed in different levels of the skin. So they can be subdermal, they could be under the muscle, deep on bone. So there are different places that they can be placed. That can be inadvertent placement because the person doesn't actually know where they are in the skin, or they don't know where it should be. Or it could be the correct placement because there are certain fillers that you want to put near onto the bone, and there are certain placements that you fillers that you want to put more superficial. Regardless of that, fillers can migrate. So they can move. So as practitioners, if you do a filler, you say to people, you know, you could, if you need to, you can massage it because you can manipulate that filler for the first 48 hours. I think technically you could probably manipulate it for much longer. And as I say, we're learning much more now. So I work with a plastic surgeon in Harley Street, and we have a lot of patients now coming to us from that era 20 years ago who started with the fillers, who are now older. Their aging profile has changed, so the fillers now look very obvious, and they want to go back to being natural. They want a facelift. Surgery can be a very natural way of rejuvenation, even though it sounds a very scary way of rejuvenation. So they're now worried about all these fillers. And when you open up faces, you can see fillers all the way through all of the layers, regardless of, you know, oh, that was placed superficially. It can have migrated throughout the layers. And it's kind of a mess. It's like people say, well, can you take that out? If you've got opened up a face and the filler is like honey, how are you going to take that out? You can't take that out. There's nothing you can do. Okay, you could dissolve beforehand, but that doesn't, if the filler's been there years, then that might not be very successful. And there are lots of debates in the medical world about whether you dissolve fillers before you do a facelift or not. Patients will say, well, I haven't had fillers for years. But you open up the face and there is filler there. It's not doing the job anymore that it did when it first went in, but it is still there. And you might see on social media, people have done scans of faces and they haven't had fillers for years, but they can clearly see the filler in the face. So there's lots of issues. So I think when you're doing a very deep massage on people with facial fillers, theoretically, I believe there is that potential to move it. And even if it isn't, if a person then has a problem, and let's say goes to a plastic surgeon and says, oh, these fillers have moved and blah, 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 and they think, well, how has that happened? Oh, I had this deep massage, and I reckon that's what's done it. It's all a blame game, really, and nobody takes ownership. So I think it's a bit of a minefield for people who are working on patients, not, you know, who've just had subtle enhancement and that's been well done and everything else, but maybe patients who haven't, it could be a problem. So there's no easy answer, unfortunately, I don't think.
So again, I think it comes back to the practitioner's consultation and finding out what they're having, when they're having, what else they're doing, what they want to get out of the treatment, and adjusting the treatment. So if somebody has had fillers, let's say around the mouth, there's no reason why you can't massage the top of the face. So again, it's looking at how can we adapt this treatment so that we are not causing any potential issue.
So, I mean, facial fillers in these scans have been found in places that they were not put originally. So they can migrate, as I say, a distance, but by then they're there, so that, you know, you're not going to do any further damage. But certainly doing the manipulation in the area that the fillers were placed possibly should be avoided, I think.
We talk to our students that we train them, and we do say just don't massage that area. Just don't.
No. I think once once the effect, so people will say, oh, I haven't had my fillers for a year. And you would have to say to them then, has the effect of the filler
Yeah.
worn off? Because there can be a real cumulative effect with filler. So you can have people who, let's say, have their lips done, who've got very thin lips, who have a series of treatments, and then thereafter they don't need it again for years, if ever, because they've got this cumulative effect. So I think the key question is, when did you have the filler, and is the effect still there? And if the effect is still there, hasn't reverted back to how they were originally, then you've still got to treat that patient as having had filler. Does that make sense?
That's a really good tip.
Mm.
Fabulous. I will add that into our documentation.
Mhm.
So you mentioned hyaluronic acid, and you said it is not animal based. Is that entirely not animal based?
I will have to check
Or
that
is
for
it a
you.
brand thing? Because the one I am more familiar with is the Restylane.
Restylane is hyaluronic acid.
Yeah, but is
The
that,
brand name is Restylane.
yeah,
Hyaluronic acid. I don't think it's vegan.
okay.
Uh, I would have to look into that, but it's definitely not vegan.
And then you also mentioned PRP.
So PRP is platelet-rich plasma.
Ah, so
That's
that,
the one.
okay.
See, a lot of going back to where we are now, we're looking at biostimulators, we're looking at biofillers, for example. So a biofiller is where the blood would be taken from the patient. That the blood is then spun in a special centrifuge, mixed with gel, and what we cleave from the blood is platelet-rich plasma, which is your PRP, and that contains growth factors. So then you can either directly inject that as the true PRP, and it's used a lot in the scalp for hair growth, skin. That's the one used for joints and things like that as well. But it can also be mixed with a gel and injected as a filler, let's say, with your own
Okay.
PRP in. Now, whether that's a bit gimmicky, possibly. Um, you know, there's fors and against. You know, there's a lot of money to be made out of these
Mm.
treatments, and they do prey on people's
Vulnerability.
vulnerability.
Mm.
And there might not be a huge amount of evidence until 10 years time. And you know, this is the other thing. I get patients coming to me saying, oh, what's new? And I think, why do you want to know what's new? Have what's we know. Don't
Yeah.
have what we don't know. You know, but if we can do no harm with something that's new, like PRP, but I mean, PRP isn't new, but let's say it was new, we're not doing any harm because it's your own
Yeah.
blood, your own growth factors,
Mm.
and that's fine. So at worst case scenario, it will do nothing and you've wasted your
Yeah.
money, but as long as that person knows that that's the potential.
Yeah.
But if it's something synthetic that we haven't got the evidence on, then you know, but then that comes down to personality type. There are people that want new.
Mm. Yeah, absolutely. Yeah, there are.
So um
And then
so
you were talking to us about fish.
oh
Is
gosh,
that a filler?
the polynucleotides.
Yes.
The polynucleotides meaning bond, sorry, poly meaning bond, and nucleotide is the nucleonic acid.
Yeah.
So it's a chain of nucleonic acid, which are we find in our own DNA and RNA. So we find DNA and RNA in every and which are then polynucleotides by default in all living organisms. And so in regenerative medicine, what we're trying to do is biohack the cells at cellular level to trick the cells into see, we're naturally programmed in aging to decline.
Yeah.
That's why we, you know, go into menopause, all of these kinds of things. So we're, you know, it's such an amazing process of, you know, um, uh,
The cycle of life, isn't it? Mm.
cycle,
Yeah.
exactly. But we our world is changing. We're not living in a cave anymore, but our bodies still think we are. So we react in those ways, but we're living in the modern world. And so we are now trying to biohack that sort of aging process. So for some things like, you know, old age illnesses, because we might be living longer, but we're living not very healthy. So we have, you know, care homes full of old
Mm.
people who've got dementia and things like that, just, you know,
Yeah, yeah,
living,
yeah.
not living. And the idea is we want people to live longer, but for healthier longevity. And so this is a big movement within medicine at the moment, but also then aesthetics runs alongside that. And so we're looking at that within the skin. And polynucleotides have been around a long time, as most of these things have, but it's kind of come to the fore in aesthetics, more so because we are now in that moment. We had this technology probably 20 years ago, but people wouldn't have understood it. They wouldn't have wanted it. They wouldn't have been able to comprehend it. Whereas now we're moving into this natural look, appearance. We're moving more into well-being. We're kind of getting back to our roots and understanding that we've moved so far away from that we need to get back to it. So polynucleotides are a way of stimulating our own extracellular matrix, give it the tools that it needs basically to be able to regenerate and repair, because it's going into decline. And we are not allowed in this country to use human extract, but we can use animal extract. So trout and salmon sperm is the closest to our own DNA
Wow.
in our
Who would have
DNA.
known?
Who would have known? It's sustainable, it's ethical in the way that it's, well, if you're a vegan, then you would obviously not agree, but it's
Yeah.
you know, if you listen to the companies, they would say it's sustainable, it's ethical, and they use that DNA then that's injected as a gel into the skin. Anything in vitro is not going to last very long on the skin. Hyaluronic acid, these polynucleotides, once they're injected in, they're not going to last very long, sometimes days. But it's while they're in the chain of events that they set off, and that pathway of events. So they are stimulating the cells to the fibroblast cells to produce collagen, to produce hyaluronic acid, all of the substances that the extracellular matrix needs to be firm and plump, and providing antioxidant protection as well. They're used for skin priming in terms of before surgery, so we can get skins ready for surgery. So surgery is like a car accident to the skin. You know, it's a big event, and it's then going to have to cope with much more repair than it's used to, for scarring and internal repair. So we can use polynucleotides to give the skin the tools that it needs when it comes to that repair. So there's lots of ways that it's being used at the moment. Insofar as your practitioners treating anybody with polynucleotides, as I say, it's utilizing their own ability to repair their own skin cells. So as long as that treatment has not been, you know, they wouldn't do a massage straight after a treatment, but, you know, a week after would not make any problems at all.
No. Fabulous.
And in fact, going back again to the sum of the parts, increasing the blood circulation, improving the lymphatic system, are only going to support those kinds of treatments.
Yeah. So the fillers are different from injectable moisturizers that are just...
Yes, skin boosters. You know what? The problem is you have so many.
Yes.
You have fillers, and they are categorized. You know, you have HA fillers, and other fillers, and other. Then you have these skin boosters, some of which are hybrids, so they could be part filler, part skin booster. Going back to the HA fillers, hyaluronic acid, the fillers that we know, let's say to do a lip enhancement, are what we call cross-linked. So they're bonded to make a fixed gel. But in skin boosters, they are uncross-linked. So they're free HA.
Right.
So they're not going to give you any filling capacity. They're only going to give you humectant capacity and moisturizing capacity. So by putting those in, so if somebody says, I've had a hyaluronic acid booster, that might be very different
Yeah.
to a hyaluronic acid filler.
And
But
again,
you
sorry.
don't know, because
Right.
it could be a hybrid.
Okay, so yes, and I think this is where the integrity of the facialist comes in, to make sure that the clients understand exactly what they've had done, what they should do. And of course, we know, going off topic, the majority, not the majority, a huge amount of people that practice these things really haven't got a clue what they're talking about.
No. And you know what, as a patient, if I, you know, again, one of your reflexology practitioners, if I went to them as a patient and they said to me, what have you had? And I'd say, well, I'm not sure. I
Mm,
should be safe in the knowledge that I can go back to my practitioner and say, oh, I'm going to have these treatments. Can you
yeah,
tell me what I've had? Could you maybe even liaise with that
yeah,
practitioner?
yeah,
And that should happen,
yeah, yeah.
because there shouldn't be any hiding. If you've
No.
not, you know, there should be that sharing of
Transparency,
information.
really, isn't it? Yeah.
Absolutely, absolutely. But you don't get that a lot,
Mm.
and that's the problem. So, you know, therein lies the problem.
So that's what we need to aim to improve.
Mm,
Collaboration, transparency, and
absolutely.
yeah,
Because I think when somebody is asked, I mean, we say it to our patients, you know, if we have a surgical patient and we say, oh, could you just go back and ask your practitioner? But tell them you only want to know because the first thing that goes off in their heads is, oh, is this person going to sue me? And
yes,
that's why you're asking the question. But, you know, people are a bit guarded.
amazing. I've learned so much.